This is our last session for the day. Basically, this will be a panel. It's building collaboration in the middle of a global pandemic, why, what, and how. And I'd like to thank Dr. David Jaffray from MD Anderson for hosting this panel. He is also the Chief Technology and Digital Officer at MD Anderson, and he's really just kind of awesome ever since I've met him, and I feel like he'd be really good at karaoke. But I'm really glad you could be here. Thank you.
Thanks, Angela. I hate to disappoint you when it comes to karaoke. It's a really nice position to be in to bring this panel together for this discussion. And the morning has been full of a conversation around collaboration, collaboration within institutes and collaborations across institutes. And so the panel today is really to talk about building collaboration in the middle of a pandemic. Why, what, and how. And you heard from Andy talking about the initiative that myself and Caroline, you mean the panel, and many others have been involved in, called the D3CODE initiative. And that was an initiative that within Anderson, we really brought a lot of different teams together to go after an objective, which is to understand how COVID-19 would affect the care of cancer patients moving forward. And this really drove an entire team data science paradigm, which I'm sure we'll get into in the conversation. And we brought all kinds of different medical disciplines together within oncology and started sharing data. The IT teams worked collaboratively across the organization to get data flowing, and totally new ways of thinking and approaches to collaboration emerged, which was so fantastic. And then in parallel, we started a conversation with Rice, and in the milieu of a pandemic and us trying to figure out how to learn about cancer and COVID, we connected with Angela and Lydia to say, if we could just connect the data science capabilities at Rice with what we're trying to do, we could do more together. And in the challenges of a pandemic, Angela came up with this speed dating paradigm, which was illustrated in this GatherTown initiative. And she talked about this in her presentation, but really trying to think out of the box of how to bring people together. And that led to the creation of this specific morning in the data science conference track. It's changed a little bit from what was initially called out, but the idea that we could connect data scientists with people working on hard problems and bringing data together, and that whole conversation has led to this event. And as we were going through it, there were many thoughts that people had about the brain swarming, as you heard earlier, different ways to figure out how to work together. And in many ways, the pandemic, the urgency of it, gave us that crucible, that's Andy Futreal's word, crucible, to sort of explore how we can collaborate differently. And so on the panel, in addition to Angela and I, we have Caroline Chung, Associate Professor of Radiation Oncology and Diagnostic Imaging, been involved in the imaging front, but now more recently, very active on the data governance side, associated with D3CODE, but now moving on from there. Chris Jermaine, I think I spelled your name a little bit wrong, possibly. Professor of Computer Science and Program Director, Data Science Initiative. Really great to have you join us as well. Andy Futreal spoke earlier on the D3CODE initiative. I've been a partner in crime, realizing that the collision of COVID with cancer was an opportunity for us to learn to help our patients and help to put that protocol together. And Lydia Kavraki, Director of the Ken Kennedy Institute. She's a professor of computer science and has been a partner and a collaborator in the ecosystem in the Texas Medical Center and works closely with us. So it's a pleasure to have everybody on the call and join in this conversation. If I missed anybody, I don't think I did. There we go. Good to see everybody. So we have some questions that we're going to go through, but I'm not going to take us through those questions individually. Rather, I'm just going to open it up to individuals. If you can hear me okay, open it up to individuals to sort of just talk about, what's happened in the past 6 months or so, or 8 months, in your setting where the pandemic seems to have influenced the collaboration opportunities. And if you could connect it to what we're talking about here today, that would be fantastic. Who wants to go first with that? Any takers?
David, I can go first. I can talk a little bit about the RISE perspective. So with the pandemic, RISE switched from we are all together mode in the RISE campus to an online mode. Initially, we switched completely online for the remaining of the spring semester. We continued working with our students over the summer remotely, and now most of our classes are remotely. So the pandemic has actually given us a lot of work in some sense. We had to switch our classes online, working with our students online. This is not the mode of operation that you're used to it, and I must say not our preferred mode of operation. So it has been a challenge, I think, from our side to start this collaboration in the middle of the pandemic, but a very welcome challenge. The virtual format allowed us to connect, maybe not in the way that we would have liked to connect, being in the same room and talk about the problems face to face, but it allowed us to connect, and maybe more people participated than would have participated otherwise. However, all the people who have participated on the RISE side are in the midst of a huge amount of work with classes. I mean, our mission is an educational mission foremost, and adding new projects is a challenge for many people. We work primarily with students and with postdocs, and our students and our postdocs are also taking a hit in their work because of the pandemic. So I think we are finding ourselves with very challenging problems. We are finding ourselves very engaged in this pandemic, and there is urgency from the RISE faculty and students to help. And facing at the same time issues on how we work together during the pandemic. So I would say it has been a blessing on one side, and it has created, I think, in the minds of all the faculty and the students at RISE, it has created a discussion on how we proceed with the collaboration now.
Very interesting. I'll pass it over to the MD Anderson side. Dr. Chung, what's changed in your world? I know you collaborate a lot. I've seen your acknowledgement slides. What have you seen? I mean, of course, you're interacting different with patients because of virtual care and the like. But from a collaboration point of view, how have you seen the pandemic change collaboration?
So I think I would agree with Lydia. There are good and bads to the whole work from home and virtual environment in this pandemic hitting. I think trying to organize a meeting amidst multiple collaborators was a feat in itself back in the day when all of us were flying around in different time zones. And I think that the availability of everybody all of a sudden being in front of their computer all day has made that happen a lot quicker. And I think some of these, the speed at which we've brought this together, even within the D3CODE effort, is really reflected by the availability and the willingness of people to actually engage and actually have the time to engage. I think it's gotten to the point where we need to reset what our rules are of setting web meetings without necessarily considering other people's schedules. I think this pendulum has swung way over to the other end, and we'll probably have to find a new balance over time, because I think that people are slotting in meetings before you know it, you blink and there's 5 new meetings on your calendar. But I think at the same time, I think this has helped us accelerate things. I think, what used to take 3 months for us to schedule a meeting in person to get everyone in that room, we're able to appreciate that people can connect from wherever they may be. And if people perhaps some people have needed to travel amidst this, they're still able to connect because we are connecting virtually. And that convenience of being able to do that has really helped us accelerate some of these collaborations. The other piece around it is, I think that the teaming that you see around the COVID effort and realizing this is an urgent need that's global, I think has really brought people together and really to take a step back from thinking about their own data and their own way of doing things, but really trying to think outside of the box of how do we reinvent how we collaborate and how we communicate, and being able to take yourself out of your normal frameworks to actually try something new. And I think that, the Gather-a-thon is a great example of trying something new. Brainstorming has also been a great example of trying something new. And the whole D3CODE effort of team data science at an academic institution and getting leadership to support to think about things like group authorship is something new. And I think I'm very optimistic that we'll have gained and hopefully take along those gains and those learnings as we move forward beyond this pandemic.
Great, good points. Chris, you want to jump in? Chris, you there? I can't hear you, Chris, and you're not moving. Hey there.
Is this over? Can you?
We can hear you, but you're a little bit breaking up. But try again.
Yeah. So unfortunately, I lost about the last 2 minutes of that.
It was really good.
So I don't know what I'm being asked to say, but
I think the question is just from your perspective, what you're seeing, how the pandemic has changed the collaboration opportunity, the collaboration cross-section, in your experience. What are you seeing from your experience?
yeah. So I think it's interesting. I mean, I feel like in a sense it's sort of exposed some of the difficulties that we have at Rice collaborating across the street. I've always collaborated with people in the Texas Medical Center, with people at MD Anderson. But the traditional model is that there's this huge long ramp up, right? I meet somebody, they have an interesting data set. We have a long series of meetings, students get involved, a PhD topic gets proposed around this. And it's, we're talking like a 3 or 4 year window. And to an extent, this is how we have to work at Rice, right? Because our business is mostly graduating PhD students and teaching courses, right? And so our research is largely PhD student driven. And it is difficult for us when something like COVID-19 just pops up and demands instant action. Like I said, it really sort of exposes the limitations of the kind of classic university research model. Because often our students are engaged in other projects, right? It's difficult to, take a 4th year PhD student who is smelling graduation and sort of take them off of something and put them on COVID. And I think one thing I think it's got to cause a discussion, especially like in a very traditional university like Rice. Like, how do you react quickly? Right? How is the traditional model that we have where we sick PhD students on problems kind of inadequate when something comes up like that?
Yeah, I mean, the rapid change, I think, is going to be a challenge. I mean, one of the things that we've been thinking about from a starting research projects perspective is I've had many students and they've blown a year or two just trying to get the data lined up. And one of the things we really think is interesting as far as the D3CODE initiative was to start to really take away that, because that was going to be a major barrier for us to make progress if we couldn't get the data moving. And so I'm convinced that's a valuable thing. And I think it can help not just internally, but between organizations. So I think that is something that we really want to persist moving forward. Andy, you want to add? And you look like you're not looking at the camera, but you might be. It could just be delayed. Andy was having trouble with audio earlier.
I'm trying. I keep getting kicked off.
I hear your audio. There you are.
Can you hear me?
We can hear you. Keep going.
Well, one of the issues is technology doesn't work that often. So that's one of the issues I'm having today. So in terms of collaboration, it's kind of hard to collaborate when you can't talk and you can't see. That aside, I think what it has, it's to deal with the ability to how do you bring people together really quickly? And I think that has proven
Andy, I think what you just said was very important, and I'm really sad that I didn't hear it. Could you repeat that? You said it's important to bring people together really quickly, and I think that's a very important thing. Can you pick up again on that thread? I hope. Oh. Come in, Andy. Over. We lost Andy. But this point that he's making, I think, is really, really important, and I'm going to try to fill in. You there, Andy? Okay, I'm going to try to do my best, channel my best anti-Futreal. I won't do the accent. That would be a challenge. But I mean, this sort of speed is important. Agility and intensity, I think, is important for collaboration. I think we suffer when things take too long to happen. And yes, it's worth doing things that take time. I'm not saying that's the case, but somehow, if we could somehow just reduce the latency in our interactions, and whether it's the data or the meetings, I mean, the idea that getting a meeting scheduled in 2 weeks is the definition of success drives me crazy. So to me, there's an opportunity to talk about the latency and how we can take out the latency and support collaboration. And Andy, I was trying to continue on your thread around the speed. Maybe you want to jump back in.
I'll do my best if it'll let me stay on for more than 10 seconds at a time. Yeah, I mean, I think that the rapidity with which we were able to bring people together, and it was around almost a universal acceptance that speed mattered. Mm-hmm. And the notion that somehow this pandemic is more important than cancer is a bit of an anomaly to me. But we need to have the same idea around speed that we do for this, that we bring back into the cancer space. So I think there's a huge opportunity to leverage sort of the ability to bring teams together. Having said that, the one point I would bring up is echoing Caroline's comments, where it has become all too common now to have 6 hours of Zoom calls, literally start and stop. And that is not the definition of collaboration or team anything. That's the definition of exhaustion, because you have to have time to think as well. And so I think there is, we have to sort of let that pendulum sort of swing back to the middle a little bit, take the good, but realize, there's something with the brain doesn't need, constant stimulation in a Zoom meeting 6 hours running. I mean, there's just no time to actually think in that particular space. And that's what I find probably the one thing we need to sort of modify a bit as we move forward.
Totally,
but the
love
rest
it.
of it has been remarkable in the ability to move quickly.
Lydia, you want to say something? I think you.
Yes, David. I want to say something. I mean, echoing what actually Andy and Chris and Caroline has said. The issue of speed and how fast we can adapt and change. I mean, now this is COVID-19. It could be something else in the future. To me, it's very, very important. And institutions like MD Anderson and Rice University, as Chris, I think, mentioned already, work in very different ways. So for me, this is a wonderful opportunity to re-examine our internal structures and to rethink what needs to be in place for us to be more agile, to be able to respond not only to a crisis, as it happens now with COVID-19, but also to amazing ideas that may come our way, and I hope will come our way during our research. So how do we take something that we find in our research and push it either from academia to MD Anderson, or MD Anderson to academia? I mean, this relationship between different institutions that are organized around different goals. So to me, this is it's very exciting what is happening in the context of D3CODE and COVID-19. But I also see that as an opportunity for us to think, as I said before, about the infrastructure and the ways that we need to work to achieve something which is bigger than what each of us can achieve individually.
That's fantastic.
Yeah. I totally echo Lydia's points, and I think that the most exciting piece of D3CODE is that we did bring together this umbrella protocol, and we brought investigators together. But what has grown out of that really is this inspired team data science thinking around the institution, and also the infrastructure. As you say, we're thinking about our data differently. As David has mentioned, that we were building the pieces to help us aggregate and find that data faster. So those infrastructure pieces that we're building, we can leverage for many, many years to come. And I think the same way that we're rethinking how we're approaching data, we need to take a step back and rethink how we're approaching, our policies and procedures in terms of collaborating across institutions. And I think once we've figured those pieces out, we could really streamline what this collaboration really could look like moving forward.
It's like we've had a little taste of what it can be like to be agile. And I think it's exciting because people are going to get that flavor and want more of it. which is good. But I kind of think that everybody's kind of become a little startup minded, even no matter where they are. And I think it's addictive. So I'm hoping that, as Andy points it out, we'll take it from COVID back to cancer, because cancer needs the priority. And we could move faster, to Andy's point. And so I'm super excited about the kind of getting that latency down and making it faster. Great points. Lydia.
Mm-hmm. Mm-hmm. Another related point, David, if I can speak for a second, is how do you form teams? How do you form teams that have members from different institutions and maybe members that have aligning but a little bit different goals? And this is, I think, something that we can think, because and we can put in front of us as two different institutions. We work with students, we are graduating students. I mean, these are the people that will be working on the projects from our side, students or postdocs. You have a slightly different model. I mean, you involve students, but you also involve researchers that work in the institution. For faculty, I mean, we have our, let's say, our research agenda. We try to get funding for supporting our projects. So financial support for anything new is always very, very important, and something that we need to keep in mind.
Yeah.
But it's also the mindset. That is, how do you align your goals with the goals of somebody else when they are complementary? Well, of course, there needs to be some complementarity, but I don't think it's obvious, and I don't think it's something that we should assume it happens automatically. I think people need to work on this to make it happen.
No, absolutely. And how do we expose people to common problems, and how can we find out what the skills and capabilities are? I think that was the speed dating thing that we did with GatherTown was a great, a way to kind of start that thinking. But there's so much more that can be done. I think we just barely saw the iceberg. There's a lot more that could be done. And I think the compelling part is that if we see the agility, the speed with which we can work, and how it changes the engagement, that should inspire us to try to do more in this regard. Chris, you want to add?
Well, yeah. So I'll just, for the sake of argument, I'll sort of come down on the negative side, or something that I think that causes me to think about is, so again, Lydia mentioned sort of that there are maybe different goals, right, on different sides of the street. And I think one thing that I always sort of agonize over a bit is that, right, publication is important if you're at MD Anderson or you're at Rice. And we can all agree that having a science or a nature paper is a good thing, right? But, even simple things that I think we need to think through going forward, right? A Rice PhD student who works in machine learning, their dream is to publish in NeurIPS, right? But publishing a top quality medical journal, I mean, that's nice, but it's not necessarily going to advance their career. The same thing happens in reverse, right? And so just simple things like what are the participants going to get out of it? I think for a faculty member, this is easier, right? But again, I always come back to our workers are not exclusively, but for the most part, PhD students, and aligning these goals is, again, I think it's just something that we need to think about in the time between now and the next emergency, right? I think that these are the kinds of questions we need to address.
I mean, this is an important point, Chris, and I totally agree. And that it was Dr. Chung who raised early on that if we're going to do this team data science paradigm, who gets recognized for their contribution? If someone does a great job of bringing fantastic data set together, how do they get recognized? And this has been, I think, it's a cultural shift that working together can accelerate. But there has to be an incentive paradigm, but not necessarily the same exact incentive paradigm that we have today. I think there's been a great conversation on that front. And one of the things we did was to say that if you're going to go for promotion at MD Anderson, and you've been part of the D3CODE team, and you help build the architecture so that many, many more people can contribute, and the D3CODE team gets recognized in the publication, and you've been part of that team, and we keep good track of everybody who contributes, then that should go on your promotion record. There's a long conversation, but it's very powerful. Andy. think you wanted to say something.
No, not me. I've been trying to keep up, coming on and off. So
you're struggling. Caroline, I know you were in that conversation early on. In fact, I think you raised the question in the first meeting because you understand, people have to build their careers and so on and so forth. So I love your thought.
So I think in terms of attribution of work, that is something we definitely need to consider. To Chris's point, I'm more curious to hear, as these PhD students are coming through, what types of end goals do they have? What are they anticipating? Is it, if it's a postdoc at MD Anderson, doing a project with us during a PhD would be a great thing to do. So I guess it just depends on what their aspirations are as they're coming through in these PhD programs. Just by the way, I have a postdoc position posted, so just throwing it out there. But I think that if that depends on what that aspiration is. So as part of this discussion around how do we actually collaborate better, if the people who are really going to be engaging and doing the work, a large proportion of that workforce, if you will, our PhD students, we need to learn more about what their end goals are and how do we actually address that as we think through the projects, and what types of learnings are useful for them in terms of their ultimate career goals and directions.
That's a great point.
Right. I mean, just to address that quickly, I think there are different types of PhD students, right? But I would say that, our very top PhD students are maybe, at least in computer science, are thinking about a faculty position in a computer science department. And certainly having a publication in a top infectious disease journal is a desirable thing for such a student. But as I said, I mean, ultimately, that's not as big a deal as having a publication in a sort of domain-specific machine learning venue, right? And unfortunately, I mean, it takes some thought, because for the infectious disease specialist, applying existing methods and finding something really interesting is maybe the best you can hope for, right? But then for a Rice PhD student, applying existing methods is, again, it results in the nice domains, medical publication, but not in where for many of them, what their goal would be, right? Because it would be applying an existing method, and they have to develop methodologies to publish in computer science. And yeah, so I think all this can be worked out, but it sort of requires all the participants to kind of think what the other side is bringing to the table and what they need out of it. And I'm not sure everyone understands that. I mean, I don't think I have, I think both sides need to do some learning.
And I do have a question for the group along that lines, because I think that I've talked through with trainees, the fact that the world is changing very quickly, and sort of the traditional job domains that you can think of in terms of direction and career, those walls are being broken down. And we're now talking about how do we actually collaborate across the street better, and that networking and collaboration is such a key piece to a lot of the career paths that people may eventually get into. So how do we actually endorse that new way of thinking, and how do we actually support that shaping of people's careers to foster better collaboration as a whole generation moving forward?
I mean, at the risk of dominating the conversation, I think one thing, I'll say that the large majority of our graduates who do data science at Rice, maybe Lydia would disagree, but I would say that they end up going to Google and Facebook and these sorts of places. And I think we would love to have more of them end up at MD Anderson. And if that were the case, then of course, publishing in cancer and all, these would be a benefit. I mean, somehow, I don't know that we're necessarily happy that all of our students go to big tech. I mean, that's great for a percentage of them, but I think that, if we could send more of them into medicine, that would be wonderful.
I think one thing that we can think about doing is, if we can get closer to the problem, maybe we can identify the need for new methods. I mean, right now, we're just happy to get some data across the street so someone can apply an existing method. We have some very hard problems that I think we really should get the methodologists closer to. And if we can make that more transparent, where people who aren't domain experts can kind of come in and say, you should think about this problem in a different way. I mean, maybe we should craft something different. I mean, we're dealing with extremely complex issues around data, and I'm sure you guys all have seen it in different fields, but on an extremely important topic too. I mean, I can't believe that we couldn't actually encourage new method development by some of the problems we're working on. And I'm convinced the only way that we'll get there is get the methodologists closer to the problem. Because I think we simplify the problems because then we can apply the methods we know exist. And that's not the right place to start, according to Einstein. Right? You want to start with the real problem and work on it. So I think getting closer, I think, has a value that way.
Yeah.
No,
David, I cannot agree more with what you just said. I think it's very important. If I can make a few comments, things are changing fast, and I think we should be open to adapting. Okay, I don't know what would be the best model at this point, but I think we should have the discussion on how we should adapt. And this is for us, but it's also for our students. So yes, the culture of the students for many years in computer science has been tech companies. But now we see people who have different industries. Who have different interests. And also we are seeing a shift that comes also from other from other factors. For example, I know many of our students are thinking a lot about privacy and ethics and ethical use of the data and how they are going to work on problems that are going to affect health and the environment, for example, which is something I did not see some years ago. So there is a shift that's happening around us. And my opinion is that we should be forward thinking and we should see what is coming in the future and move towards what each of us thinks is valuable. Now, the culture among the students is changing, but I think it's one of our responsibilities to expose the students to a much, much larger and broader set of problems that they can work on. I have been working in interdisciplinary topics for almost 20 years now. And I have heard everything. I've heard from the attitude, just give me the data and I will develop my methods, to the attitude, I don't care about your methods, I just need the data and then I know what to do with the methodologies. I mean, you can find the whole spectrum right now, okay? And I'm sure that if we put our faculty together, we'll find the whole spectrum. And it is, it is a normal thing. I mean, this is what has been happening. But this needs to change, in my opinion, and it needs team science and it needs attribution of who is working. People need to understand different facets of the problem, even if they are not going to work on the problem. That is, understanding the problems, for example, with the data collection is very important to the people who are developing the next set of methods. And right. Yes, we want the people who will develop the methods and the people who will work with existing methodologies together, okay, not in separate camps.
I have Andy on the phone. Okay, Andy, can you hear us?
Yeah.
Can you guys hear Andy? Yeah, they all nodded, Andy. That means yes. Can see that.
Okay.
Andy, do you want to comment? I mean, I think Lydia made a fantastic set of points regarding this whole idea that, and it came about by the idea of multidisciplinary conversation that Caroline talked about, and then Chris saying, how do we get the methodologists closer? This is a very good direction that we're moving in, and I know you've always pulled teams together, Andy. So please comment.
Yeah, I think I heard bits and pieces, and I would agree. One of the major issues we have is it's become apparent, and it's always been apparent, but it's become really apparent that we need to move away from a very tumor-centric view of trying to think about cancer patients to a patient-centric view. And it makes for an easy thing to say, but it involves incredibly complex interplay of data types and factors that we don't have the methodologies to do at the moment, to be candid. I mean, and you bring that together with the fact, and that will hopefully get worse, that cancer care in and of itself is a sparse and episodic sort of venture. And you have a situation where, the current approaches where, we may be in other industries where you have, thousands of data points streaming from a sensor that all look alike from 15 different 100 locations simultaneously. That does not happen in the cancer space or in the medical space more broadly. So I think there is another sort of wave of innovation around the methodology space. And I think to Lydia's point, I think it rolls all the way back to the very first thing you do when you think about a trial design or an experimental design. What is it you need to measure? How are you going to do those measurements? And really think about the methodology to extract the maximum value in the interaction space between those measurements. Because that's where the business end of, who does well, who doesn't do well actually lives. And some of it's locked in 30 years worth of experience in a medical oncologist's head. But we need to be able to get that out of the medical oncologist's head and promulgate it so, the person not being seen by the 30-year expert has just as good a chance of a good outcome as the person who does. I think that does require a wholesale new approach to intimate interactions in terms of thinking about the design of the actual experiment and the measurement to analysis of that and the implementation on the other side. It has to be simple enough that it can be implemented in a clinical context. So I think there's a continuum of innovation in the technology methodology space, measurement space, to actually implement. No matter how clever we are, we have to be able to implement it in a clinic setting. So I think there's a huge challenge from a systems perspective all the way through that, I see as a growth industry for quite some time to come. And I think that's where I think the sweet spot may well be. Speakers.
That's a really good point. Chris, I want to you raised the challenge of how to get the guys and girls who are working on the methods. And I understand the computer science publication, it needs to be a novel method. That's the whole idea. In many ways, and how do we bring those teams closer? Like, we're interested in getting closer and bringing the data closer and bringing the problem more fully described, as Andy said, closer. How do we get the methodologists closer so they're not working on voice and driving with Google and Tesla, but they're working on a really important problem? Any ideas?
That's a difficult question.
Good, got someone smart working on a difficult question. What should it call?
Yeah, I think that this is the thing, that, like I said, with COVID, because the time period is so short, it really exposes the difficulty here. Mm-hmm. I think the obvious answer is it takes time and work, right? Actually, like we I don't know if everyone can see this, but as somebody just, I guess it was, so Kristen Dyfus, might have gotten the name wrong, sort of pointed out here that if you bring a methodologist in, they have to understand the domain, right? That's one important thing, and that becomes a big burden for the clinician, for example, right? Like, how do you teach? And so I feel like the thing to do now is to start now. So that when the next crisis shows up, we have methodologists who understand the domain at least a bit. We have those partnerships set up. I don't know that there's a way to do it quickly. I feel like maybe it's just time and hard work.
We saw in the brainstorming example how multiple disciplines can come together. I don't know if you saw that presentation, Chris, Caroline gave it. And it creates an ecosystem where you're innovating, solving problem, but it just lets people from different disciplines participate. And that transparency on the problem, I think, is really, really powerful. And it lets people sort of say, like, I didn't think that was a question to ask, because I think people thought it was stupid. But it's not a stupid question. It's a very good question, actually. Mm-hmm. And to think beyond the methods, to challenge the assumptions that we sit on already through an open dialogue, I think is really powerful. And I think the brainstorming paradigm, maybe we should weld Rice and MD Anderson together with the Brainstorm initiative, and just have these events where we can have the agility to have that conversation and make people bring forward the methods we were thinking about, but then we need a method that doesn't exist, and have that conversation. This is a great conversation, you guys. I think I could pass. And is that Andy? You want to comment? I heard a voice, and it wasn't Caroline or Lydia's, and I don't think it was Chris's lips weren't moving. And it wasn't Andy? Okay, we are at 12:40. We're like 10 minutes past the time. I think we could talk for a long time. There was one question at the end of the question, which was, how do we do this without wine and cheese? I'm trying to figure that out still. And hopefully we will have wine and cheese in the future, and this conversation will continue. And we'll have it around a big brainstorming board where we can expose the problems to the future methodologists in the computing science and data science programs at Rice. So I'd like to thank each of you for participating. I'd like to thank Rice for hosting so nicely this event over the past several hours and engaging us so actively in the event. Thank you to Lydia and to Angela in particular, who did a ton of work to make this happen, and to all the speakers. And so with that, I'm going to draw the panel to a close. Thank you, everybody.